Hello, my name is Dr. Steve Alukonis. I'm a board-certified chiropractic orthopedist with over 25 years experience. I've been treating and working with peripheral neuropathy patients for a number of years. Now, I want you to know we have great and advanced new technologies that we didn't have a few years ago, designed to help diagnose and help treat successfully peripheral neuropathies. What is peripheral neuropathy? Peripheral neuropathy means damage to the nerves where they are not working correctly or they are dying in your extremities. Usually it begins in your feet or legs or in your hands and arms. Periphery means outside of the center. So these nerves, most of my patients tell me this is what it feels like, the peripheral neuropathy. They come in telling me that they have burning, terrible burning in your feet or legs or hands, tingling, prickling type of feeling, sometimes sharp, shooting pains, cold hands, hot hands. Sometimes it fluctuates. Cold extremities in your feet. A lot of times they tell me they can't even feel their feet and have trouble with walking or balance. They fall. They tell me things that it's getting worse instead of better. They also tell me that quite often their doctor tells them that there's no hope and no treatment to help improve it or stop this condition. Well, right off the bat, I want to let you know this. In most cases, majority of the cases that we treat, and we are selective, we have helped them. With the newest technologies that we have today available, the therapies and the treatments can dramatically improve your condition. What makes us different? What makes me different? Well, first of all, I want to let you know that we leave no stone unturned. When you come here, we completely give you a great evaluation. We want to find out what the root cause, what started the neuropathy to begin with. There's all kinds of causes. Diabetes could cause it. Vitamin deficiencies could cause it. Certain medications, statin drugs for cholesterol. It could come from your spine. Spinal stenosis could cause it. It could come from immune problems, immune disorders, and the list goes on and on. There's a lot of causes, so we try to determine what's the cause. And a lot of times it's idiopathic, which means we can't find the cause. But I want you to know that with the latest treatments that we have, in most cases, it doesn't matter what the cause is because we can still help. Our goal is this: to one, stop it from getting worse as much as possible. Two, try to reverse any nerve damage as much as possible, as quick as possible. And of course, three, reduce your symptoms so you're comfortable, so you're happy. Try to help you get rid of the numbness and the burning and the pain where you're having trouble sleeping at night. Try to help you where you can feel the ground. It doesn't feel like you're walking on hot pokers or broken glass. That's what we do. That's what we're here for. How do we do this? Well, we look at all your medical records that you already have. We see what type of nerve conduction test you had done. Then we do a complete neurological evaluation and we test the nerves. We want to determine exactly what nerves are being damaged, the extent of the damage, if it is getting worse, if it is going further. For instance, is it going from not just your feet and legs, but now in your hands? We want to know this. Then Once we can determine the extent of the damage, from that point on, we can determine if we can accept your case. We only accept the cases that we truly believe we can help. So once we do all that, then we sit down with you and we go over the report of findings, go over everything, what may have caused it, what you can do at home, the type of treatments that we do, how long is it going to take, and any cost involved. All of this is covered. Most peripheral neuropathies that we see, people have been suffering for a number of years. Most of the time, it takes several months of treatment to help your condition, to help slow it down, to help stop it, to help reverse it. And this can be done. A lot of my patients tell me, most of my patients tell me that their doctors said nothing can be done. There is no help. There's no treatment for peripheral neuropathy. You're going to have to live with it, suffer through it, maybe take pain medication to alleviate some of the discomfort, but ultimately they say it's going to get worse. Well, these same patients that were told that have gotten a lot better here. The majority of those same patients, we have been able to improve their quality of life and made them much happier.
Neuropathy real bad in my feet for probably at least 8 or 10 years or longer, and I saw his ad in the paper, so I decided I'd come up here and try it, and I came in and he did the sort of an analysis thing and to see if he could do me some good, and he said, I think I can help, and he has. Sensation, the numbness that I had real bad is just about gone completely.
That's amazing. So 8 to 10 years, that's a long time to be suffering.
Right.
And your treatment program was for 3 months.
If you could consider my feet, everything, my feet feel a lot better when I'm walking. If I have to stand a lot.
Much pain in my back, and one day I just looked at my newspaper and I saw this ad telling me about what Dr. Alukonis did and so forth, and so I said, well, I guess I'll look it up. So I called and made my appointment to come down, and I talked with him, and then after a couple of days he evaluated me and he said that he thought he could help me with the pain in my back and some with my neuropathy that I've had because I had Guillain-Barré. So I've been coming here for almost 3 months now, and he has really helped me immensely. I'm almost free of back pain now. Most of the time I have none, and I have some improvement in my neuropathy also. I'm getting around much better, my walk is better, my gait, and I'm feeling like a much better person.
Your daughter had mentioned.
Yeah, my daughter said to me, she hadn't seen me in a year, and she came down here to be with me, and she said, Mom, you look like you're 20 years younger. You're acting like you're 20 years younger, getting around now. She said, really? And I said, well, I'm feeling much better too. And my strength is better also. I think it's really helped my back. I know it's helped my back immensely, and it's also helped my arthritis that I also have too.
What are some of the treatments that we provide? One of the treatments, and you can look this up on the internet, is called Rebuilder. You can look it up, rebuilder.com. It's the latest in technology where we use electrical current that is the same frequency as a healthy nerve. And we place these pads over your feet or hands and stimulate those nerves, allowing them to wake up, become healthy again. Not all of them. I mean, some of them are going to be damaged beyond help. Some of them are dead. But there's plenty others that we find that we can bring back to life and wake up. We see it every day. Every single day, people tell me that they can feel their feet again, they have less numbness, they have less shooting, stabbing pain, whatever symptoms, we hear that they are feeling better. The other treatment we use is cold laser therapy. That also helps stimulate the nerves. We use infrared heat, infrared light. Sometimes we need to use spinal decompression, non-surgical, especially in a lumbar spine. That may help get the nerves unpinched in your spine and help stimulate the nerves that run from your spine down into your legs. I had a woman recently that when she sat down, she would get severe numbness in her calves and feet. And from the first time we did non-surgical spinal decompression, she came back 2 days later and said it was the first time that the numbness was greatly improved when she sat. And through a course of treatments, she was greatly improved. The other thing we use is gentle manipulation of the feet. Sometimes we use foot orthotics to help take the stress off of your feet. We use specific nutritional supplements to help your nerves heal. Very specific ones. A lot of times we'll do blood work, lab testing, to help determine the underlying cause of your problem. Sometimes it's a thyroid condition. Sometimes it's an autoimmune problem. So we want to know this. The more we can determine the cause, the more we could uncover this, the more successful our treatment is. So I want you to know this, that there is help out there. We are helping people. The other thing I want you to know is that it's not a quick fix. It takes time. And it could take several months for your symptoms to subside. But then again, most of the people that we see have been suffering for a number of years. Another cause could be diabetes. Like I said earlier, that's a very common one. So we want to help you with your blood sugar. We want to help you with your lifestyle on the way, if you exercise or not, the type of foods you eat. So that way, we can help the nerves heal and regenerate. So I want to allow you to have faith again. Almost everyone that comes in here, they've lost confidence, lost faith, and they feel down and out, that everyone keeps saying that there's no help, but there is. There is. It may not be medicine, and it may not be surgery, but there is help. So we are here for you. Please call us. Our number here is 321-783-1960. Again, I'm Dr. Steve Alukonis. Thank you very much.